So I'm Chris Hempel. I am mom to Addi and Cassi. They have a rare disease called Niemann-Pick type C. I'm sure you heard about it a little bit earlier on the panel. Prior to my kids getting diagnosed with this rare condition, I spent my career in public relations working for Netscape, which is one of the first internet companies, and started my own PR firm. Gosh, it's got to be like 15 years ago now, representing mostly technology companies in the Bay Area. That's where we're based, in San Francisco. And so I'm here today to talk to you a little bit about PR. And Wendy, I know you probably get a lot of questions too about what is PR. I think there's a big misconception about what it is and how to do it. So I wanted to talk a little bit about basically anybody can really do PR. It's really not that hard. You just really need to know what it is. So I wanted to talk a little bit about like what it is and what it isn't. One thing that it isn't is like we don't buy ads. We don't write stories for reporters. We don't put up billboards, and we don't create things like jingles for products. So basically what we do is we promote individuals and companies through editorial coverage. So what is editorial coverage? Editorial coverage are things like websites, magazines, news outlets, TV shows. It could be like the Today Show or CNN. And essentially, we work with reporters. That's what they call media, press, media, reporters. And what you do is you need to develop relationships with these reporters and pitch them various stories. So earlier I was listening to some of the interesting stories I thought that were coming out of this panel earlier. Hold on, let me get it. So we had some interesting stories that came up when they were talking about Niemann-Pick. One of the panelists talked about ancient genes. Did you hear that? Did anybody think that was an interesting kind of angle, like that maybe a reporter might be interested in writing about? There was something else that came up about creating some kind of Craigslist where we could learn about different programs and so forth. That might be an interesting angle for a reporter. We heard about citizen scientists. I thought that was a really interesting thing. That's something that I use in dealing with the media. I consider myself a citizen scientist, and I sort of pitch myself out there as a citizen scientist. I thought that would be an angle that the media would be interested. The gal that was talking about narcolepsy, where is she? She was talking about her, the FDA, and how, there's a lot of openness at the FDA. I thought that would be an interesting angle to pitch. The HPS mom was talking about taking her children, into the lab. And I thought, wow, that was kind of an amazing story. There was the blind dogs. That was really cool. Crowdfunding. So there are all these different kinds of like interesting stories that were coming out of this meeting today that the media would be interested in. What most people don't really do is they don't really know how to create their story. So, I think you need to all ask yourself, like, what is your story for your particular foundation or for your child's illness? And is it Diane back there that's got the great pictures going? She's got like these storyboards that she's writing. I think if everybody, could create something like that, sit down and think about like what is interesting about your particular illness or your foundation, what you're doing, and try to come up with these different kinds of angles that you could then go out and pitch to the media. It's called pitching, talking to the media and contacting journalists. So I know a lot of people are afraid of doing that, so I wanted to give just a few practical examples of how to approach the media. So I have 3 examples here that I jotted down earlier. With my kids, you hear about Niemann-Pick, lysosomal storage diseases. Most reporters, they don't know what that is. We coined a term called childhood Alzheimer's because our kids have a progressive neurological condition. There's a dementia component. And so it made it very easy, like when we went to talk to reporters about, well, what is wrong with your kids? Well, it's essentially like a childhood Alzheimer's, we'd say. And they'd say, whoa, wow, what's that? And then you could get into the fact of, exactly what it is. But you need to create something that's relatable to the average person, for the average person to understand. One of the other things that we did, and, just given my background, it wasn't in healthcare, it was in technology, but I just made a list of all the different healthcare reporters that are out there, at Time Magazine, at CNN, at Self Magazine, just reading these articles. And doing a lot of reading is key too. When you want to reach out to a media person, I typically will contact them and say, hey, I just read your article in Time Magazine on gene therapy. That's really cool. Did you know about Niemann-Pick disease, or, what we might be doing with studying this particular gene? So, you have to relate to them, to their stories, because there's a lot of outreach, a lot of networking. That's what PR is. Let's see, what else do I have here? Interesting angles, that media like to pick up on. For example, with our story, they really like to pick up on the mom out there, and the mom reaching out to scientists. So there's a lot of stories about me, even though my husband, does a lot of the work. For whatever reason, they really like that particular angle. So we get a lot of stories about, what I've been doing to pursue a drug. And we just sort of draft on that. I mean, that's what's working. That's kind of what they like. So we take advantage of things, as much as we can. So human interest stories are really, really key. And that really involves, you have to really let people into your life. If you go on our website, you'll see me in my bathrobe, because we've had news crews there, and it's we've really opened up our lives. And so you got to be prepared for that. If you let people into your house, or, to, witness us giving our kids medications. That's what it's going to take. It's going to take that kind of openness to get those kind of interesting stories that the media are looking for. And so, we made the decision early on that that was important for us, and we were gonna do that. I think another example is, trying to create. If you don't have a story, you've got to create a story, create one. So how do you go about doing that? So here would be an example of Addi and Cassie's doctor. She opened a new clinic, and she wanted the media to cover this new clinic. Well, our local media have no interest in just showing up at the clinic. What are they gonna do? What are they gonna put on the news? So we actually created an event. Around Christmas time, we did a fundraising with all these different toys. We reached out to the firefighters who got involved. We created an event where they came to the clinic. We had the kids there. We had the firefighters there. We had Sparky, the little Dalmatian, and we invited the news, and it was a huge story that ran on the news. So we actually had to create the event and then reach out, to the media to tell them the event was happening, and it was a huge success. So, that's, the media likes, visual elements, Sparky with the kids, etc. So you might have to do that. You might have to create your own event. And also, they like things that are newsworthy. I'm going to talk a little bit about newsworthy and also building relationships. This is going to be a really weird example, but a friend of mine showed up, about a month ago, and had a photo of a twister they came over for a party. There's a twister in our backyard, and they're like, hey, look at this picture. This is really cool. And I said, oh, I guarantee you I'm going to send this photo to the news outlets or the paper, and I guarantee you it's going to be in there tomorrow. He's like, no way. So I said, sure enough, I took the photo. I wrote a little bit about where the twister was, the details on it, called up the news, called the assignment desk, and said, hey, there was just a twister in our backyard. And they're like, great, send us the details, and we'll pitch it to the weather guy. So sure enough, they were interested in the 11 o'clock news. We turned it on. There's the picture of the twister, all the details that we sent in. I also sent it to our local newspaper, because I know that they have a gallery of local photos. So I sent that in, and it was in the newspaper the next day. So I give you this example because I'm planning next week another event, and I know that the weather guy, they like to do on locations. So there's going to be a golf tournament for Addi and Cassie's doctor, and I'm going to invite the weather guy to come over and do his live shot from the golf tournament. So sure enough, they're interested, and we'll likely be able to get coverage And so that's about building relationships. And I tell you that because it was a simple thing that I did to reach out to the weather guy. Now I'm coming back to him like for a favor 3 months later, and he remembers that, and he said, sure, I'll come out and do it. So it's really like you've got to reach out to people, and it just requires research. I'm happy to give anybody lists of health reporters that I have. You know, I have a pretty exhaustive list of who all the top people are. I recommend don't waste a lot of time on press releases. They cost a lot of money. The media do not read them. The best, most effective thing you can do is create interesting stories and then pitch those particular stories to the media.